the phone was very important and very painful. Today, we serve 250 brands, hundreds of millions of phone calls, household names such as Tory, Burch and Under Armour trust us. So what we see with urgent cares, there is typically 30-40% missed call rate. A third of all calls are going unanswered simply because there's too much volume and the staff is too busy. So what we see is, and what we track, what we call the call to visit metric. So what percent of the phone numbers that call in end up coming in for a visit. And what we want to show is that before flip and after flip, I think it's one of those win-win-win situations.
Brian, thanks so much for hopping on today's podcast. For the listeners, we have Brian, co-founder of Flip, joining us today. Yeah, Brian, thanks for making some time out of your busy schedule.
Great to be here. Psyched to chat.
Let's jump right in. First, your background is quite interesting. You and your co-founder started Flip out of your dorm at Cornell, from what I understand, and you guys have been building it together since. The company has grown a lot since then. How did the business evolve from like early voice AI technology to what it is today?
Yeah, it's been quite a ride. I think that we really wanted to build something. We really wanted to build something that felt simple and obvious, and tried a bunch of things, pivoted. And the initial trigger for us was when Alexa and Google Home and Siri and sort of like that last era of voice AI was having its moment, and obviously flawed and now outdated, but at the time that technology was so much better than the experience that you would get when you call a business. And the opportunity felt obvious to bring this fast emerging, fast improving technology into that sort of business environment. And so got to building and really sort of narrowed in on what do we think the right way is to take this technology and package it up into a product and then bring it to market such that businesses that don't have massive engineering organizations or, today massive AI organizations are able to pick up the technology, pick up the product, and very quickly get great results that are, clearly measurably having a positive impact on their business. And then it's just, it's the founder journey. You just keep on going and have some fun along the way.
Right on. And it's amazing this technology has been around so long. Like I think we all can remember when Alexa came about, even Google Home. A lot of us have Google in our homes. And organizations are still trying to either kind of wrangle with adoption. Like should we adopt this in our our call channels, whatever it is. And from what you guys have seen, like in your own customers, like I got the sense that you guys have really evolved from, playing in the retail space to now healthcare, which is an area I'm very interested in myself. Like, can you tell us a little bit about what's triggered this move from retail to healthcare, and what are you guys seeing there?
Yeah, I think it's amazing really how much momentum and how much enthusiasm there is about this emerging category of using AI, your communication channels, but really the phone being the ultimate of those. I can't think of many examples of new categories that so quickly had so much momentum and general buy-in that not only was it going to work in the long run, but it is ready and it is working today. So I think that everybody understands AI at a macro meta consumer level. I'd say over the last 12, 24 months, just the acceleration of sort of belief and urgency inside of businesses is it's awesome. It is very cool. And this is one of those categories that feels obvious and people are excited to invest in. So we started, when we graduated college, we were working in the transportation industry, and then on the backside of COVID, moved into retail and raised our first significant round of funding at the time. So fast forwarding to today, we serve 250 brands, hundreds of millions of phone calls, household names such as Tory, Burch and Under Armour trust us to have conversations with their customers every day, representing their brand. In 2024, we made the step to add healthcare as that next industry. And first, we don't take these things lightly. I think we deeply believe that this technology only works and the product only works if it is deeply industry specialized. There are just too many different workflows, too many edge cases, too many integrations. This is not a thing where there's 2 or 3 use cases and you can set it up on your own and you can vibe code it and be off to the races. This is much more dense and, both in breadth and in depth of a solution to really get it right. And so you need to have deep industry specialization. You as the vendor need to bear the burden of building these workflows and these integrations into the platform. With that being said, we were always excited about healthcare as a great area for this, and had an opportunity come across our desk in 2024, started with a 5-location pilot with CRH Healthcare. Shout out to Bill and Tim and Andrea there. And they operate 100 plus urgent care centers based out of Atlanta. And I think that they've faced the same, issues that have been persistent on the phone in healthcare forever. And we were able to get in, we were able to build with them, we were able to learn with them, initially sort of in a beta, and then brought additional similar, sort of at scale urgent care providers online through the end of 2024. We were able to establish what has been, an incredible partnership with Xperity, who is the leading EMR in the urgent care space. And over the last 18 months, we've gone from, a couple hundred clinics to a couple thousand clinics. And urgent care is not the biggest of specialties, right? There's roughly 12,000 roofs across the country. So when you talk about just that level of adoption that fast for a piece of technology that is new, that is patient facing, it's really been pretty incredible. And really for us as outsiders to healthcare coming in, it's been our customers that have really pulled the product forward and have educated us around, could it do this? Could it do that? What about this scenario? And we've really learned and built with them along the way. And now as we go into 2026, really taking that step of, okay, urgent care is the front door of healthcare, and what are the next doors to walk through?
Yeah, well said. I mean, the growth that you guys have had is very impressive. You said, from serving over 250 brands, big retail brands like Tory, Burch, Under Armour, to now this jump to healthcare. I want to dig into urgent care, but before the work you guys have done in urgent care, but before I do that, like why healthcare, for the audience listening, like beyond it being like 1/5 of our economy, it's a huge industry, right? Like, what did you guys see there that others were missing, and it could be from the perspective of your customers, right? Like, what are they struggling with in healthcare that you guys were like, yep, we saw that in the retail space, this is how we can address it. Like, what did you guys see that others might have been missing?
I think as we looked at industries, certainly it makes sense to start with consumer industries, right? So we don't have our AI doing customer success or sales with our customers. So you're focused on industries that are consumer facing, where volume is higher. And then for us, as this technology is brand new, we were looking at what are the industries that are at the frontier of providing premium experiences, and what are the industries where there's competition and there is a need to innovate and there's a desire to innovate. And with retail, we always talk about, right, in retail, companies don't refer to themselves as firms or enterprises or organizations. They refer to themselves as brands. And that is, it speaks volumes just about how they think about the experience that they're providing to customers. They really are the gold standard. And with healthcare, the patient experience is so important. And with as big as healthcare is, it is also super competitive. And there's just been a growing sense of sort of urgency to innovate and eagerness to lean into technology to enable better experiences. So those were sort of, sitting in maybe the ivory tower, the things that excited us. When we went and started speaking with urgent care and sort of healthcare organizations broadly, there was a unanimous feeling that the phone was very important and very painful. It is a big part of how organizations are engaging with their patients. and also very broken at the same time, right? Unbelievably hard to staff and
to train, too. Like, there's so many,
right, and so much of the staff.
Yeah, the front desk staff is slammed. I mean, if you take a smaller clinic or practice, a lot of they shoulder a lot of the volume of patient requests and inquiries, and they're still obligated to do their day job, and then that problem is expanded when you get to a larger, like, urgent care facility or even a larger hospital or health system, right? Like, they get even more call volume, that they need to know, how do we deflect this so that we're focusing on the patients that have high acuity, like the actual ones that need our help right now versus the ones that are just checking for a status update or whatever it is,
Yeah, we rolled out last summer with a couple hundred location group, and these one of the benefits of this technology is that it is relatively lightweight to implement. So if you think about other AI use cases in healthcare, right, there's a lot of attention that goes to AI scribes, and the opportunity there is obvious, right? I don't think anybody would doubt that. But the implementation is also incredibly heavy, right? You need to drive adoption inside the room from the provider across a large organization. That is really hard to do. The benefit of doing AI over the phone is it can really be implemented by IT and by marketing, and it is not something where it's not a tool that the providers or even the front desk staff are inside of every day. So the training load is significantly less, which makes the implementation easier, faster, and higher degree of certainty, easier to test it. So I think all of those things, right? If you think about whenever anybody is considering pursuing an initiative, there's sort of the balance of what is the upside that I can get from this? What is the level of effort and cost? And then what is the perceived probability that it's going to work? And the fact that this is both high in value and low in cost and effort is important, right? It's an important consideration whenever anybody's considering a new project. But to circle back to the story, so we were rolling out with this 300 location group, and their CTO made the decision that they were not going to communicate that this was rolling out to any of the staff in the clinic. And what he wanted to do was he wanted to get a sense for whether the impact would be large enough that the staff would notice it without it being alerted to them, and how they would respond to it. So he chose a clinic that was nearby to where they were located, and he went to the clinic for a day before go live and was just there and was able to feel the energy in the room, was able to hear how many times the phone was ringing and how hard the multitasking was for the front desk staff. Sat silently, took notes, maybe spoke to them about what the experience was. A couple weeks later, went back after Flip had been rolled out and sat there and listened and had conversations. His takeaway was the phone's not ringing, but the patients are coming in, and the staff couldn't really figure out, like, was the phone line broken or like what was happening, but it was a very obvious and stark shift that happened. And it gets at exactly what you're saying, right? The front desk staff, they're responsible for so many different things and really an ever-growing number of things. And when you've got a busy waiting room and you're focused on all these things, the last thing that you want to do is have the phone ring again.
And for that clinic example, no, I think well said. I mean, like, other technologies have tried this, right? Like IVRs, and for the non-technical folks listening, IVRs are like the things where it's press 1 for this, press 2, and then it takes you down a phone tree. Like, they've tried that. Like, the technologies like that have tried that to fix this problem. But we all know they're broken. No one wants to sit there with an IVR in healthcare when you're dealing with your own health and enter a bunch of numbers. Like, what fundamentally changed even in this clinic example when you replace some of the, let's call it, incoming phone trees with this voice AI? Like, what fundamentally changed for that clinic and their staff and the CTO?
Yeah. So starting with the basic, right? Right now, if you call any healthcare clinic, you are most likely going to be greeted with a robot that answers, that says, "Hi, thank you for calling so-and-so. Press 1 for this, press 2 for that," etc.
Yep.
That's the IVR technology that you're talking about. What we're doing is we're replacing the IVR with an experience that looks and feels and sounds like you are talking to ChatGPT, that is integrated into all of your systems. So your EMR system, your appointment system, your RCM platform, if that's an important piece of the equation. And then it is configured and it is designed to automate all of the types of conversations that your patients are calling in about. And so from the patient's point of view, they're calling, instead of getting this sort of decision tree, they're getting greeted by a very friendly AI assistant that is capable of completing all of the routine actions that ordinarily would require the front desk. Everything from scheduling appointments, modifying appointments, asking questions about your bill, getting the status on your lab results, all of those routine things. And then from the point of view of the organization that is deploying the technology, there is the benefit, right? There's the improvement of the patient experience. There's the improvement of the staff experience. And then there are the outcomes that you're able to drive. So what we see with urgent cares is there is typically a 30-40% missed call rate. So a third of all calls are going unanswered simply because there's too much volume and the staff is too busy and they can't afford financially to put an additional person on the phones. And when you look at the topics of these calls, what you see is that roughly half of these calls are pre-visit. So when somebody's calling into the clinic, half of them have not yet come in and they have questions or information or want to schedule directly with you over the phone. And so the opportunity is, right, if you put on your marketing hat for a moment, it's like, gosh, oh my God, like we've invested so much to capture the attention, to make sure that the community is aware of our practice and the services that we offer. And maybe they've clicked on the Google ad, or maybe they saw the billboard or whatever it is. And now they're calling at the last moment before they're deciding if they're going to come in, and you don't answer the phone. Like, gosh, is that, a horrible leak? So what we see is, and what we track with the organizations that we work with, is what we call the call to visit metric. So what % of the phone numbers that call in end up coming in for a visit within whatever the right time period is. So in urgent care, that's usually within a 72-hour time period. And what we want to show is that before flip and after flip, by answering every single call 24/7 and by having the capability to serve your patients and to book your patients and to give them this experience, you're actually going to convert more people into visits. And for all of these organizations, that's the lifeblood. So I think it's one of those win-win-win situations.
I think you answered my next question already, which is like, I know you called urgent care kind of like one of the front doors of healthcare. Like, I was wondering why adoption happened so quickly. You said it from a couple hundred clinics to a couple of thousand. And I think you said it right there with call to visit metrics. If you guys can get phone calls from phone call to visit to 72 hours, like that makes it a no-brainer for some of these urgent care clinics to adopt this technology. It's a type of, I think, healthcare too, like that you receive when you need it fast, you need it now. So it makes sense to have something that can kind of triage these phone calls and get you to the right person at the clinic or whatever you're calling in about. I think urgent care specifically is, I don't want to call it like high acuity because you can get anything in urgent care, but it's like, it's urgent. It says it right there in the word, right? You want a quick answer. So it makes sense to start that you guys started there and you're seeing a lot of adoption in that space.
And the way that the platform has evolved as we have built it with our partners and with our clients is you start with all of the calls that are coming inbound to the front desk. And then you think about the calls that are going to the nurse's line about lab results, about prescriptions, right? And you can sort of follow the patient journey, right? And then sort of at the tail end, you think about billing and you think about medical records. And so Flip is covering the full patient journey. And the organizations that we work with are able to decide which of the use cases do they want to flip on, and which are the ones that they want to be escalated to their staff, and which queue, right, which group, which team do you want to send those calls to. And then what we did was we added on outbound engagement as well across each step of the patient journey. And now there are things like after you come in for a visit, we're able to reach back out to you a couple days later, see how you're feeling, make sure that you've gotten everything you need. And if you need to come in and be seen again, go ahead and schedule that appointment. And similar use cases, right? Letting the patient know the result from their labs that they got done, reaching out about outstanding balances. So really thinking about the full patient life cycle and how you can support everything that's coming in and then also engage from an outbound standpoint.
Yeah, that's fascinating. I mean, like the fact that you guys can follow that full patient journey, I think probably makes it super valuable for some of your customers, and you can almost get a sense of like how does that journey vary from healthcare facility to healthcare facility. Like urgent care looks like this on average across our clinics, and then you go to another specialty, this is what it looks like, and then you can sort of tier the use cases like you were talking about, accordingly.
As we have gone deeper and deeper into urgent care, so many of the leading urgent care organizations have expanded into primary care. They've expanded into ortho or other sort of ancillary services. Many of them are either owned or joint ventured with the large hospital systems. And so you get into really interesting opportunity spaces where this clinic is part of a broader network and opportunities to improve the referral process and all of these sort of exciting use cases emerge as you go deeper and deeper and spend more and more time with your clients and learn about what matters, learn about what's taking up team time and build and test and iterate with them.
Yeah, you're preaching to the choir as someone that helped establish some of these early phone technologies about 8-9 years ago for one of the leading health systems in the country, so I fully see the sort of landscape for you guys, expanding beyond just urgent care, right? This goes up to the health system level as well. They need help with these things. Now I want to get into like the easeability, the usability of Flip. Like you mentioned, that it integrates with like EMRs, appointment systems. It does inbound, outbound. Like why has Flips been so easy to deploy compared to maybe some of your competitors or other technologies, and how important are those integrations to your customers?
There's so much noise around AI, customer experience, patient engagement, whatever you want to call it. When you go one layer deeper to like understand how to make sense of the market and all the players that are out there, the first divide is industry specialized solutions versus generic platforms where you can sort of, build anything from scratch yourself, or in most cases work with large professional services or forward deployed teams that, those organizations are working with large enterprises across every industry. At a basic level, that is do I want to build everything from scratch, or do I want to use the best of breed solution that is already built? And so our belief, sort of circling back to where we started, is that the best results, right? When you speak to organizations across any industry right now, the best results are when they are working with these industry specialized solutions. And then when you go a layer deeper there, it's one thing to have focus from a marketing standpoint. It's a different thing to like really get it right, how the industry specialization should apply to the product. And part of what I think that we have done well is we have had a lot of focus, and we have built out and really refined what should the experience be when somebody is calling and they want to schedule an appointment. What should the experience be when somebody is calling and they have questions about their bill? When you work with Flip, you're not starting from ground zero, building a version 1 and then iterating to version 2, and right. From day one working with us, you're standing on the shoulders of giants. You are turning on a workflow in a couple of minutes that is already at version 100. And it is battle tested across millions of phone calls, across thousands of clinics. And so what I think that we've gotten right is if you can really focus and you can specialize in terms of who you are working with, you can really invest a lot in making these flows, making these experiences tippy top notch, and then abstract out what are the things that are unique from one organization to another. What do they need to control about their systems, about their business logic, about the way they want to represent their brand? Make controlling all of that very easy and allow it to sort of sit on top of something that is already sort of tried and tested and proven. And so I just think that we've gotten it right over the years in terms of what should be built into the platform, what should be controlled by each client that comes online, what should the UI look like for them to control it, what should the business model look like that allows these people to feel confident and feel ready to take a first step and to try it and not wait another 6 months or another 12 months or another 24 months. So I think it's a lot of small things along the way, but it comes from the deep specialization and listening to and working with the clients that have sort of shaped us over the years.
Yeah. Well said again. And I think in healthcare, I would take it a step further. It's not even just like industry specific. It's like specialty specific, right? If I bucket like urgent care as one specialty, primary care and family medicine as another, right? Like I think in healthcare specifically, like providers want to see that specialization for their specialty. Cause like you said, the use cases will vary, right? Like the types of calls that urgent care gets may look a little different than like a primary care, provider. So, on this point about like specialty specific solutions, like talk to me about your guys' like expansion plans beyond just urgent care. Cause you said even in the urgent care space, you're noticing like some of your customers, have connections to primary ortho. I think you mentioned earlier, like, what do some of those expansion plans look like and what makes it, what type of specialties make for a good fit with Flip at the moment?
You're right that part of what has made this work so well so fast is that we're not just defining our focus area as healthcare. We're not just defining it as healthcare providers. We've gone all the way down. We spent 24 months just singularly focused on urgent cares. And that has been to our benefit, right? That's an advantage, not right. That is a benefit from a constraint. And so now as we go, right, so we closed a big round of funding at the start of this year, and we are certainly expanding, right, building out the team to be able to expand into more areas. We are very particular around what are the right specialties and the right types of organizations that we want to be working with. And equally importantly, when we say we are going to do something, we're not just going to work with one organization in dermatology or one organization in dentistry or veterinary or hospital system or revenue cycle management organization. When we find the right opportunity and when we feel like we are ready to add an additional area and we start working with that first pilot organization and start building relationships with some of the key partners that we're going to need to integrate with, that is a full force commitment. And what we've learned is that our business grows by having a reference list as long as our customer list. When we take care of our customers, they take care of us. And all of these communities are small. Your reputation is everything. And so we understand that when we take on a new project, it's our obligation to deliver at the level that we expect.
Yeah, you said it best. It's like building an expertise in that industry and specialty. Like it's clear you guys don't just dive into one just to add another customer. It's like, no, we want to make Flip work for that specialty. So the next urgent care clinic that comes about or next primary care, it's already, like you said, on version 100, it works for them, like
exactly right.
Yeah, that makes sense. And I know earlier you mentioned, Flip does both the inbound and outbound of the journey, and essentially both sides of communication. It makes me think like, wouldn't certain even, I don't even know if it's a specialty, but areas like virtual care make sense for Flip, right? Like places that already deal with tons of phone calls virtually, telehealth appointments or over the phone, physician to patient or staff to patient, right? Like, do those areas make sense to you all? And like, how do you guys think about those type of automations?
Yep. Many of the leading urgent care organizations have a telehealth component to their offering. And so it is part of what we support today. We also, and it's funny how sometimes these industries can mold together, pharmacies and online pharmacies was an area even before we moved into urgent care that our retail and e-commerce sort of footprint had sort of bridged into. So when you look at some of the leading pharmacies, some of the leading online pharmacies, they also work with Flip, and there's a very real like telehealth lean, virtual care lean to those groups as well.
Yeah, no, I think that's important to highlight because I think when people hear the word healthcare, they think like inbound, a lot of inbound calls. You're a patient, you're calling, but there's a lot of aspects of the industry that do a lot of outbound. Like you said, pharmacies, telehealth, virtual care, like all these areas are making already a lot of outbound communications, and it's an area for Flip to play in as well.
Yeah, value-based care is so huge when you speak with organizations that are doing primary care and just managing care gap. And there's, the engagement is certainly two-way. And when you're going outbound, it needs to be treated, right? With great power comes great responsibility. When you can pop up on the cell phone with a branded caller ID of any patient you want, whenever you want, barring any sort of constraints, right? Barring opt-in, that needs to be done thoughtfully, and it can't be short-term optimized. It needs to really be orchestrated with a long-term view and with a lot of respect for the patient.
Yeah. Well said. Yeah. The more, like you said earlier, right? Like in healthcare, patients are consumers, right? Like they are consumers of retail already, and they have consumer expectations of healthcare. And if they don't like the service they got from, one clinic, they can easily go find another one, and now we've gotten into that point. And so like I think the providers that will scale and win over time are the ones that treat it that way, like, no, like these patients, we're not only managing their health, they are consumers of what we're offering them, so we need to make an investment into this and be serious about dealing with things like our inbound and outbound calls.
Couldn't agree more.
Yeah, excellent. And I'm super impressed by this conversation. I know I've had one guest on the podcast about voice AI, but this one was certainly a lot deeper and broader. So I appreciated your perspectives. And so for the folks listening, Brian, like that are interested in your guys' work, it could be even like, a primary care family medicine group, or even another urgent care clinic. You mentioned there's several, like a couple hundred, not thousand of those across the country. What's the best way for them to engage with you and your team at Flip, and what should they have ready before starting a conversation with you all?
Okay. It's never too early to talk to us. You can certainly find us at our website, flipcx.com, or on LinkedIn. And always eager to chat and share notes and learn from all the great operators out there.
Yeah. Well, so it's not necessarily for your CTO to do side-by-sides before you go and adopt Flip, is what you're saying.
I really do think that overall enthusiasm in healthcare around AI is fantastic, and that so much of it has been directed at the AI scribe opportunity over the last, call it 24 months. And that is a great use case, but gosh, they're going after something that's so much harder, right? And I think you're starting to see over the last 6 months, and you're going to see it more and more 2026 and into 2027, that for organizations that want to bring in AI and want to do it without massive risk, without massive expense, and with very clear value that they're getting out of it, this is a great place to start. And I think that, what the urgent care industry has done over the last 18 months is a great indicator of what's to come across the broader ecosystem over the next 18 months.
Yeah, absolutely. It's almost like the low-hanging fruit, or like the no-brainer to me. Like this is how you get started with AI. If you're a healthcare provider, like it makes sense to do. You already get inundated with phone calls. What better place to start with AI than this versus a AI scribe, like you said, that a little more complex of a adoption, integration, and then training. Right, this is very straightforward and easy to plug in, and results are quick. So yeah, Brian, it's been a pleasure having you on the podcast today. I think the listeners will enjoy listening to this podcast, and I'm personally, excited to keep tabs on y'all's journey at Flip, and I can see you guys having a lot of future success. So thanks for being great guests on the podcast and joining today's conversation.
Great, Bert. Thanks for having me.